leading initiative as Project Director at the Ahasa Division Cancer and General Hospital and Executive Director of the Bangladesh Institute of Health Sciences Hospital, as advisor of advert to BABU, BMCH and GIMCS. My work has extended to collaboration with prominent international organizations. I have served.
Sir, any comment?
Any comments or remarks?
Okay.
Comments.
This presentation is very nice and explanatory. I think so. It is a very good presentation. And if you any question, you can do that one.
Okay. So now I'm requesting Dr. S.M. Khaldeuzzaman, who is a member candidate from Dhaka 17. So I'm requesting Dr. S.M. Khaldeuzzaman to have some comment. And
Alhamdulillah, audience, Assalamu alaikum wa rahmatullah. This is an excellent presentation, Aspiring Bangladesh Policy Summit 2026. Health is wealth, and everybody wants to be healthy. If I am not healthy, I can't do anything for myself, for my family, for the society, for the country. And unfortunately, there is so much deficiency on trust between the patients and the doctors. I feel we have all logistic supports. Both the doctors, hospitals, also the financial support. But unfortunately, there is a gap between the bureaucracy, between the democracy. I want to smooth the relation. I want to bridge the relation so that we can give something for the country. We can use the money. There are a lot of examples. There is a budget, but the hospital is returning money to the government. But patient is coming to the hospital, they are not getting service. So where is the problem? We will find out that, and we will serve for the country. One more thing I will emphasize: if we, Bangladesh Jamaat Islami, can form the government, inshallah. One previous lecture, the education policy. One madam says, Siddheshwari College principal, I read in applied chemistry, but I am working now in banking service. Same thing happens to the doctors here. Sub-speciality should be enhanced. Sub-speciality, we will open so many branches, and we will enrich the sub-speciality stage by step, so then people can get the specific service. And at the same time, if we can enrich the community clinic, then the burden on the tertiary hospital will reduce. Then the demand in the bigger hospital like the Dhaka Medical College will not be overburdened. So with a very good policy, the support we have, we can give a better service to the nation. For health service, we have so many doctors. After the 5th of August, the nation already knows Bangladesh Jamaat Islami has so many doctors. With this manpower, with these doctors, we will serve the nation. Inshallah, the health service will be very good and no patient will go abroad. We will ensure that. Thank you all. Assalamu alaikum.
I am now requesting Professor Naima Muazzam.
Assalamu alaikum. I am Professor Naima Muazzam. My specialization is in microbiology. I was professor and head of the department in Dhaka Medical College for a long time and now retired. And presently I am working as Vice President of Nari Adhikar Andolan. Today we have gone through so many presentations with the vision, with the aim to have a developed country so that our country become more developed. That is our aim and objective. And we know that if we want a developed nation, there must be a healthy nation for that. Healthy nation is a very important requirement for a developed nation. And our health program that has been described today has the aim to reach that. So we are thinking about decentralization and basically upgrading the Upazila and district level hospitals, and so that we get better facilities there, better human resources there. But main challenge about is that if we, hopefully inshallah, this government will be able to upgrade the hospitals in Upazila and district level in all senses, means resources and manpower resource also. But smooth running of the hospitals, assuring the presence of doctors and full successful running of the hospital is the challenge. And inshallah, we hope that this Jamaat Islami will be able to motivate the people, those who are involved in hospital, about the accountability of their works. Not only accountable to the government or the higher authorities, but accountable to own self, accountable to the own conscience, and accountable to Allah. If we remain accountable to Allah about whatever I am doing, whatever may be I am responsible, I will be sincere and honest. And if we can motivate this, we can put this to our doctors, nurses, and all other staffs, that will help also to assure a better service in our Upazila and district levels, so that as we have planned to have higher standard hospitals there, standard services there, and referral systems there, so that there will be a diverse medical service, inshallah, and in Bangladesh, we will have a better health service. We hope for that. Inshallah, Allah will help us. Assalamu alaikum.
Thank you, madam. Now I'm requesting Professor Dr. Mahmood Hassan, Secretary, National Doctors Forum, and Member of Parliament MP candidate Shariatpur to have some comments on our policy.
Assalamu alaikum. আমি মাহমুদ হোসেন, চাইল্ড হেলথ স্পেশালিস্ট। আজকের যে পরিপত্রটা এখানে প্রেজেন্ট করা হলো, যে প্ল্যানারি নোট আমাদের সামনে রাখা হলো, আমি মনে করি যে একটা বাস্তবসম্মত বাংলাদেশের আগামী দিনের স্বাস্থ্য খাতের উন্নয়নের জন্য খুবই উপযুক্ত একটি পেপার এখানে প্রেজেন্ট করা হয়েছে। এবং যেখানে আমি যতটুকু বুঝেছি যে ডিসেন্ট্রালাইজেশন এটা একটা প্রধান ইস্যু, এবং সেখানে জনগণের আস্থা তৈরিটাও সাথে সাথে জরুরি। কারণ ডিস্ট্রিক্ট লেভেলকে আমরা যদি মেডিকেল হাব করি, তাহলে যদি আমরা সেখানে রিয়েলি কোয়ালিটি সার্ভিস এনশিওর করতে পারি, জনগণ কেন ঢাকাতে বা বেগা সিটিতে আসবে? তো সেক্ষেত্রে সবচেয়ে বড় দায়িত্ব হবে ইনশাআল্লাহ, if we are in power, then we will ensure the quality medical services inshallah up to the district level, and that happen we restore the confidence of our people. Those people can get service, try to get service at the locality, and the load in mega city will be reduced. At the same time, it will be a responsibility to develop our people's quality services, and every subspecialty of our medical science. And secondly, that I would like to say that we will establish inshallah a good governance, এবং ইনশাআল্লাহ আমরা স্বাস্থ্য খাতে দুর্নীতিকে না করে দেবো ইনশাআল্লাহ।
ইনশাআল্লাহ
কোনো রকম দুর্নীতি যেন আমাদেরকে স্পর্শ না করে, সেক্ষেত্রে আমাদেরকে ভীষণ রকম সতর্কতা রাখতে হবে, সার্ভিলেন্স রাখতে হবে, মনিটরিং সিস্টেম ঠিক করতে হবে। এবং পাশাপাশি এখন যে সিচুয়েশন, যে বাংলাদেশের জনগণের সাথে চিকিৎসকদের এবং স্বাস্থ্য ব্যবস্থাপনার যে দূরত্ব তৈরি হয়ে আছে, সেটা আমি মনে করি যে দুই পক্ষেই এটার জন্য আরো মনোযোগ দাবি রাখে, দুই পক্ষেরই মনোযোগ দিতে হবে এবং এই দূরত্বটা কমিয়ে এনে মানুষের আস্থার প্রতীক হতে হবে। সে কাজটা আমরা করব। সে কাজটা করার জন্য একদিকে যেমন গণসচেতনতা তৈরি করতে হবে, আরেকদিকে ডাক্তারদের কন্টিনিউয়াস মোটিভেশন, মেডিকেল এথিক্স, ক্লিনিক্যাল সার্ভিস ইমপ্রুভমেন্ট, সে কাজগুলো করতে হবে। তো সে সবগুলো কথাই আমি দেখেছি যে এই পেপারটাতে আছে। কিছু জিনিস হয়তো আরো একটু আমাদেরকে পিক আপ করে আরো শক্ত করে বলতে হবে এবং আমাদের প্রধান কাজ হবে ডিস্ট্রিক্ট লেভেলকে মেডিকেল হাব করা, আমাদের কাজ হবে দুর্নীতিকে না করা, আমাদের কাজ হবে গণসচেতনতা তৈরি করা, পাশাপাশি চিকিৎসকদেরকেও আরো বেশি করে ফ্রেন্ডলি হতে হবে ফর দেয়ার ওন পিপলস। সেক্ষেত্রে একটি জিনিস আমি বলে রাখা খুব জরুরি, কারণ গভর্নমেন্ট লেভেলে যেটা দাঁড়ায় সেটা হলো যে উপজেলা হেলথ কমপ্লেক্স, ডিস্ট্রিক্ট হেলথ কমপ্লেক্সের এত পেশেন্টের লোড যে ডাক্তাররা আসলে প্রপারলি অ্যাটেনশন দিতে হিমশিম খায়। সে জায়গাটা আমাদের চিকিৎসক সংখ্যা বাড়াতে হবে। তো বর্তমানে বাংলাদেশে ডাক্তার, এখন আমাদের কাছে স্ট্যাটিস্টিক্স হলো যে ডাক্তারের প্রয়োজন আমাদের পপুলেশন অনুযায়ী 1,03,500 মতো অ্যাটলিস্ট। সেখানে কোন কোন স্টাডিতে বলা হয়েছে 72,000 আছে ক্লিনিক্যাল সার্ভিস দিচ্ছে, কোন কোন স্টাডিতে বলা হচ্ছে 86,675 জন, মানে অ্যারাউন্ড 20% গ্যাপ আছে। এর চেয়ে তো বড় গ্যাপ আছে নার্স এবং মিড ওয়েফারি লেভেলের, যে আমাদের মিড লেভেলের হেলথ ওয়ার্কার আছে। পপুলেশন অনুযায়ী প্রয়োজন হলো 3,10,500 জন ওয়ার্কার এই লেভেলটাতে, নার্স এবং মিড ওয়েফারি। সেখানে আছে 56,734 জন। তাহলে আমাদের গ্যাপ এখানে 82%। তো 82% গ্যাপ নিয়ে সার্ভিস এনশিওর করা কত কঠিন। এবং আরেকটা জিনিস যেটা আমাদেরকে করতে হবে সেটা হলো ইন্টিগ্রিটি, সার্ভিসের ইন্টিগ্রিটি। আমাদের এখানে ফ্যামিলি প্ল্যানিং আছে, আমাদের এখানে মেডিকেল এডুকেশন, আমাদের এখানে প্রাইমারি হেলথ কেয়ার, নানা ভাগে ভাগ হয়ে আছে। এগুলোকে ইন্টিগ্রিটির মধ্যে আনতে হবে। আমরা সে কাজটা করবো ইনশাআল্লাহ। আমি কোশ্চেন,
Now I'm requesting if there is any question. If anyone has any question, volunteer please. Give the mic. Give mic. Yes, sir.
Hello. Yeah, thank you so much for a nice presentation. Especially for the medical sector, some of the very major issue we have to handle. Especially if you have a new turnover come as a Jamaat leads to the power, I have no idea exactly these two problem how to solve it. Number one is that, you know, there is a lot of people going overseas for the health support, especially India, Bangkok, Thailand and Singapore. I live in Singapore last 28 years. In my experience, it's totally amazing, different. And sometimes it is surprising also. Some of our friends, those are doctor in Singapore, and especially not Bangladeshi people, they say, how rich your people? They are coming to the Singapore in Mount Elizabeth, and how much foreign currency they are spent here. And jokingly, one of my friend, he used to tell me that how much money they spent in Singapore for the medical purpose, you can build at least 5 Mount Elizabeth in Dhaka. That is a very much, it's a real problem. I do not know, Jamaat or maybe the you people will how handle this issue in coming days. Okay, how to stop? Number one. Number two is the India. Let's see, lot of people going to India for no reason. For what? Our physician, our doctors, they are capable enough to address the issue, but they are going because they are getting the more foreign currency. India is earning the more foreign currency from Bangladesh than any part of the Asia, any other country of the Asia. I don't know. You have to very pragmatic way. you people has to come out the idea and address this issue so we can save our foreign currency, we can save our people, and especially the poor people. They are selling lot of things and going to India and Bangkok and Singapore for the sake of the better treatment. At least we have to handle this. The details we can work out later on. Second one is doctors' issue here in Bangladesh. We have to talk to the practical way, not but theoretical way. Lot of doctors, they are taking the, I am not use the word bribe, they are taking the lot of facilities from the pharmaceutical company, and they are just write down their medicine name. You see, this is a very common issue. If you go to the any doctor chamber and come out, there is a lot of representative people, they are holding your prescription and say they really write down or not. I don't know. You are the very much aware about that, because I don't stay in Bangladesh permanently. I used to come and go, but I have seen my own eyes. Especially these two issues is my idea. Suddenly when I came out here and I am listening from you, you people has to come out the very pragmatic and effective solution for the sake of the great interest of the people of Bangladesh. An earlier session for the quality education, I never get opportunity to question, but I just raise up the issue. Quality education and skill education, we need the necessary things. You know, the first things, we have to stop the teachers' politics. Teachers' politics, one of the sickness politics in Bangladesh. It destroys the education, especially the higher education. And second thing is that quality education. There is a lot of issue. There is a lot of PhD holder. But do you know, are they really qualified enough to obtain the PhD? No, not at all. It's my observation. Presently I am the one of the founder and trustee board chairman in Shamogdu Management University. So I am facing. I just interviewed more than 50 PhD, but honestly speaking, I am not find the qualified single PhD. Okay, so quality education and skill education you have to treat. And last but not the least is that English language, because our main problem is that we are not skilled enough to talk, write, and presentation about by the English language. Okay, from the very early days we have to address this issue also. Thank you so much.
Thank you.
Thank you for your two questions. So, for first question answer, we have big no for all commission-based practice. We already mentioned is in our policy, there will be big no for all commission-based practice in health sector. Okay, and second question already we showed in policy, we will have a direct foreign investment private hospital or public PPP project private hospital in our health country, so that international standard hospital will be there and we will ensure that people will get that treatment. And another commitment, Amir Jamaat already showed that he did his own treatment in this country. And in our Ishtihar, we mentioned that all MP candidates who will be elected from Bangladesh Jamaat Islami, they will give priority to take their health service in this country. They will not go abroad. So this is our commitment for the people, and we cannot enforce, we cannot rule, then it is their rights to go abroad for the treatment, but we will create the environment is there and we will not go. So we hope that people will also follow this thing. Thank you.
I think the question session is a small presentation, and I appreciate your questions. I think it's a short presentation, and it's very much important for all the people of the nation also, what the question arises. First of all, what he asked me, the question, people are going outside, India, Singapore. If we can, one of my hospital, Bangladesh Fertility Hospital, for fertility treatment, most of the people usually go abroad. But within 5 years, I established a hospital, a specialized hospital, fertility hospital. Mostly around 60% people now do not go to India. Moreover, almost 20 countries, from 20 countries people come to my hospital for the treatment. So I have established the example, so we are capable enough to serve the people of Bangladesh. And at the same time, if we become honest, if we give service, we can build the relation with the patients. Patient do not go outside, do not go abroad in future. In every aspect, Bangladesh Jamaat Islami will establish the example, inshallah, in future. There will be no patient abroad. In aspect that people will come, even if he or she is sick in other country, they will come to Bangladesh to take the service, and they will meet their relatives, families also.